How can ADHD and executive functioning issues be diagnosed? And then what are the next steps? So basically, ADHD is attention deficit hyperactivity disorder with or without hyperactivity. It used to be ADD, but that's not the way it's listed anymore. It's now ADHD with or without hyperactivity, and there's combined type and all of that. But really, I want to focus on what is attention issues. So a lot of times people think that it is the lack of focus, but it really is not the lack of focus, it's hyperfocus. It means that their brain cannot differentiate what to focus on. So it focuses on every little thing. So what we have to do is we have to take a look at how is their brain hyperfocusing? What are the pieces to all of that? And then test in those areas. So oftentimes we're going to do a continuous performance test. It's called a CPT, which is going to be able to look at their level of distractibility, their level of perseverance, all of these different kinds of things. And we're also going to be doing a lot of executive functioning tests that are also going to be able to look at their ability to plan, initiate, organize, self-monitor, to basically get things done, to be able to take care of their needs. So not only are we going to test in those areas, but we're also going to look to the people that know the student the best, like you guys, parents, teachers, tutors, those different people, and we're going to be looking at what their thought on their behavior is. There's questionnaires, there's rating scales that we're going to do, and we're going to basically take all of those things together, and we're going to look at, do they fit the Diagnostic and Statistical Manual, the DSM? Do they fit the different criteria that is expected based on the guidelines we are given? And then that's going to bring a diagnosis or not. So that's essentially what we do when we're looking at ADHD. And then if it's an ed code situation where we're working with a school, then we're going to be looking at the ed code, which is a little bit different than the DSM. So that is essentially what we're doing when we are looking at attention. And then basically those accommodations, the findings are going to be able to lay the foundation for accommodations like extra time or different alternative testing environments, all the different things that we would typically recommend for an ADHD kid.